Hi guys, my name is Angela and today I will be talking about thalassemia. So what is thalassemia? Thalassemia is an inherited blood disorder that affects the protein portion of hemoglobins, resulting in fewer healthy red blood cells. The anatomy of thalassemia. So normally a hemoglobin is made up of four globin chains. Each is bounded to a heme group made up of iron. Adult hemoglobins, also known as hemoglobin A, are made up of two alpha and two beta globin chains. Now, since thalassemia involves hemoglobins, the main targeted organ would be the blood. In this case, microcytic anemia would be the main characteristic of thalassemia, in which there are normal hemoglobins as well as the lack of normal hemoglobin levels, making the red blood cells smaller than usual, as you can see in this picture. Severe forms of thalassemia can affect many parts of the body, while the milder forms are usually asymptomatic. Facial features can include enlarged forehead and cheekbones, hair on end appearances that can be seen through x-rays, flat midface, low nasal bridge, maxillary prominence, wide set eyes, uh, pale appearance, as well as thin upper lips. Other organs that can be affected by thalassemia, which I will go into more detail later in the presentation, can include the liver, the spleen, the bone, the skin, as well as the heart, the thyroid, and the pancreas. Now we're going to move on to physiology of thalassemia. So thalassemia is an autosomal recessive genetic mutation involving alpha or beta globins. Genes are what controls how the body makes hemoglobin protein chains, and when these genes are missing or altered, different forms of thalassemia can occur. So for beta thalassemia, this refers to when there's either a partial or complete beta globin chain deficiency. This is due to a point mutation, which is when only one nucleotide is replaced by another nucleotide. Beta globin genes are present on chromosome 11, and there are three categories within beta thalassemia that is based on zygote characteristics. For beta thalassemia minor, this is a heterozygous mutation in which beta chains are underproduced. Beta thalassemia major is a homozygous mutation resulting in the absence of all of the beta chains, and this is the most severe. Beta thalassemia intermedia is a condition that's between the minor and the major beta thalassemia. Alpha thalassemia is when partial or complete deletion of alpha globin genes occur, and the genes for alpha globins is situated on chromosome 16, which houses four alleles that are responsible for the production of alpha hemoglobins. The severity of alpha thalassemia depends on the number of deletions of the alleles. So alpha thalassemia minor, also known as HBH disease, is when one allele is deleted, and this is the most mildest form. Alpha thalassemia major, also known as HB Bart syndrome, is when there's a deletion of all four alleles, resulting in no alpha globins produced. The severity of symptoms depend on the severity of the disorder. Thalassemia minor is usually asymptomatic or have very mild anemia. Thalassemia intermedia can have mild to moderate anemia, while thalassemia major is the version with the most severe symptom that can appear within the first 2 years of life. And symptoms can include severe anemia, general weakness and fatigue, dark urine, slow growth, jaundice, as well as weight gain due to hypothyroidism. Now we're going to talk about the pathology of thalassemia. So with reduced or absent globin production, the resulting hemoglobin molecules are abnormal, and abnormal red blood cells are then produced in the red bone marrow, which will go through ineffective erythropoiesis, causing red blood cell count to be lower than normal. An increase in hemolysis can occur due to the destruction of abnormal red blood cells by the spleen, resulting in anemia and ulcer. As compensatory mechanisms of the body, bone marrow hyperplasia occurs due to an increased production of immature red blood cells. The body also can increase red blood cell production in extramedullary sites such as the liver, causing hepatomegaly, which is enlargement of the liver, and splenomegaly, which is enlargement of the spleen, will then occur due to the overwork of the spleen from destroying all the new immature red blood cells produced by the liver. Additionally, increased destruction of red blood cells lead to an increased breakdown of hemoglobin, and an increased breakdown of hemoglobin causes the buildup of bilirubin in the blood, leading to jaundice of the skin. Gallstones can then be formed from the excess bilirubin buildup in the gallbladder, and hemochromatosis can occur, which is iron overload, from either excessive red blood cell breakdown or from the blood transfusion, can lead to a buildup in different organs such as the heart, thyroid, and pancreas. Now, iron piles up in the heart can then lead to cardiomyopathy, arrhythmias, and hypertension, while iron buildup in the bones can lead to osteoporosis. Iron buildup in the thyroid can lead to hypothyroidism, and iron buildup in the pancreas can lead to diabetes mellitus. Diagnosis and treatment of thalassemia. So a routine blood test is usually performed to detect low hemoglobin levels and a high red blood cell distribution, meaning that the red blood cells come in a lot of different sizes. Peripheral blood smears can also be done to show microcytic and hypochromic red blood cells. Microcytic meaning that the cell is smaller than usual, and hypochromic meaning that there is a decrease in the red pigmentation of the red blood cell. Lab work can also be done to rule out iron deficiency anemia or iron overload, and it's usually higher than normal. Hemoglobin electrophoresis can be done to analyze DNA and confirm any genetic mutations. And last but not least, genetic testing of amniotic fluid can be used to determine a fetal at risk of thalassemia before birth. Now, for treatment of thalassemia, treatment is usually only required for thalassemia major and can vary depending on the amount of hemoglobins. Frequent blood transfusions are then given, followed by iron chelation therapy in order to remove the excess iron from blood transfusions. Deferasirox and deferiprone are agonistic drugs given to help rid the body of excess iron. Other possible treatments can involve splenectomy for patients who suffer from splenomegaly. Medicines can be prescribed such as luspatercept and hydroxyurea can lessen the number of blood transfusions needed. And children with severe symptoms can go through a stem cell transplant to eliminate the need for frequent blood transfusions. Very quickly about AI related to thalassemia. So currently, Aga Khan University's Department of Pediatrics and Child Health teamed up with integrations expert to develop an algorithm, artificial intelligence that can detect cardiac iron overload in thalassemia patients, which is the leading cause of morbidity and heart failure. The traditional method requires a patient to hold their breath while the images are acquired, but the improved version uses a T2CMR image to examine T2 values without holding their breath. The T2CMR images requires post-processing softwares and a highly trained professionals to interpret the images. Last but not least, demographics of thalassemia. So thalassemia can affect both males and females, and the survival rate for birth until 10 years old is 99%. And as a patient gets older, the survival rate decreases about 51% at the age of 55. It is thought that the thalassemia gene is retained in certain populations because it provides some sort of protection from malaria. And thalassemia genes are widely distributed in the world, but are traditionally found most prevalent among people with ancestors living in Middle Eastern, Mediterranean, Asian, and African descents. According to NIH, alpha thalassemia is prevalent within Asian and African population, while the beta thalassemia is prevalent in Mediterranean and Middle Eastern population. Due to migration patterns, beta thalassemia is increasingly more common in non-endemic regions, including Western Europe and North America. Specifically, the United States has an increase by about 7.5% over the past 5 decades due to immigration. And that concludes the end of my thalassemia presentation. Thank you.